So thank you so much. I have just first a few thank yous I wanted to say, and then just three quick observations. So first of all, thank you to everybody who has participated today, all of the speakers and panels and moderators, and everyone in this room. There's been just incredible engagement on all levels. All the people out there on Twitter who have been commenting and engaging with this discussion. So thank you to all of you. I also want to thank Lori Gregg, who's right over there, and Salara Cruz, who's right over there, who have made all the difference in actually bringing this to fruition. Like, a lot of us can sit around a room and talk about this and say we have some good ideas about what might happen, but it doesn't actually happen at every single level without the amazing work that's happened from them. And so thank you so much to Lori and to Salara and to everyone at NAM and thank you. And so to everyone that's helped with this. I don't think I could possibly summarize what has happened today. There's just too much. I want to just simply make 3 points, which are sort of in some level a little bit random, but there are a few takeaways. The first is actually a little bit of a sidebar conversation I've been having over here with Phil Pizzo and Salima Magani, to just remind all of us that much of what we heard today has actually been contained in prior reports that have come out of this National Academies. In particular, I'd point you to the Relieving Pain in America report from 2011, and that that sometimes we know things, and it's more about implementation. And so I think there's a tremendous amount of agreement. There's a tremendous amount we know, and we just need to get it out there. And so how we can take this and leverage this to remind us of what we already have to take forward. The second is, so I'm really just borrowing from other people, because the second is something that Andrew said that really spoke to me, which was the analogies between the two halves of what we were talking about today, which is the serious illness care world, which is kind of where I come from, and the opioid use or the substance use disorder world. And that, in fact, particularly from a clinician perspective, many of the competencies are quite analogous. They are not the same, they are different, yet they are particularly around things like communication and other areas, and that we should think about that a little bit. We should try to have more communication between these groups, because for a long time they kind of worked in opposition, and we need to be working together. We are all incredibly patient-centered, and let's bring that patient-centeredness to find solutions between these sides of the coin. And then the last thing is to think a little bit about changing some of the public narratives and language that we have, and that much of the dialogue out there just in the world really undercuts the ability for good outcomes. And I think that how we talk about this whole issue really ends up framing the debate. And I guess to echo some comments that people have said, I feel that on this one, we really are far more in agreement than disagreement. I actually don't believe this is necessarily a dilemma that has so much values in conflict. There are some. And yet I do think that the framing sometimes gets in the way. And I think if we can be really careful about that and use language in particular ways, and then have great public education and embrace our colleagues in the media and elsewhere, I think we can have some better solutions. So thank you, everyone. It's been a fabulous day.